everyone. Hi, everyone. This is an episode. I'm Dr. Isabelle, Amigues, the host of UnabridgedMD. And this is actually a Coexist meeting that I'm hosting with RhMSUS for our usual monthly gathering. Hopefully, we're going to grow this because we are so excited of having a community. And in those meetings, I have really inspiring people who come and basically share their experience. And today we have Kasey, that is an acupuncturist, and I've never been treated. I do want to start. I'm a little bit afraid of needles, which is funny. But I've had 3 people that are kind of unrelated tell me how good you were, and so I'm so excited that we have you here today. And so I'm going to have you introduce yourself and tell us who you are and what is your journey? How did you get to become an acupuncturist?
Thanks, Isabelle. Hi, my name's Kasey Jewell, and I've been an acupuncturist since 2007. So do the math, about 15 years. I began my journey probably when I was about 11 years old. I think I first diagnosed myself with fibro. I was like, that's what I have. I have some fibromyalgia. Like, that's what I have. And so from then on, I sort of went through the whole Western medicine and went through everything and was just curious about these different points of view. And so, long story, chiropractic really helped me, acupuncture really helped me, Western medicine really helped me. And I just filed it in the back of my mind of like, oh, when I retire, maybe I'll just go be an herbalist and acupuncturist somewhere. Fast forward through college, went to CU Boulder, ended up with a political science economics degree, ended up in Boston, at the Kennedy School doing some work. And my boyfriend at the time, he was from Shanghai, and he ended up just buying me some Chinese medicine books. And I already had checked out acupuncture schools previous. It's in the back of my mind already. It's maybe. And I soaked them up. I just in about 3 months I could recite them all. And so I was about 22 at the time, 23, and enrolled in the New England School of Acupuncture and was there for a year. And working at Harvard at the School of Public Health in the nutrition department. So I was doing full-time acupuncture and almost full-time work. And I was like, I can't keep doing this. Because my health issues came back. And, well, they were there always. But I just was always exhausted and always tired. I remember being in school one day and I had my shirt on backwards. And I was like, okay, I can't do this. So I went back home to Boulder and ended up finding an acupuncture school there. Still was kind of on this health journey of why do I have this pain? No one could really explain it totally. I found a lot of ways to manage it, but never really understood what's going on. When acupuncture school, fell in love with herbal medicine, but where I really loved was acupuncture. It was being the political science, analytical person. I could look at a body and understand how it was just all connected. And I think, again, maybe I'm wrong, but my point of view is I think sometimes of people's perspective of acupuncture is oh, that's energy work, or that's something we don't understand. And the more I did this, the more I realized no, this is fluids. This is basic physics. You have an effect over here, you're going to have an effect over there. Mm-hmm. And so and the Chinese were just brilliant in the way they mapped the body that way. Again, and what I found really unique about acupuncture and acupuncture theory and Chinese, it was very consistent. Mm-hmm. And it was very complete in the paradigm. So it was very different than say a Western hypothesis synthesis and but they had a way, the paradigm is just about dynamic flow. And if you can see that, and they were just, the fact they could map that 2,000 or 3,000 years ago was wow. And they just knew where all the nerves were. And luckily China, in good or bad, was able to maintain a lot of that. And it came down through us. And in a lot of ways, I'm really honored to stand on so many people who came before me and so many teachers. And I know that's a big part of acupuncture is lineages and understanding so much of what came before you.
Right, so can you, we try to explain what acupuncture is. I recently tried to explain what acupuncture is because my father he's almost 75, or he just turned 75 today. Happy birthday, Papa. And he's actually taken on to learn acupuncture, which I'm always so impressed. And I think he wanted to be a doctor, and he's becoming this Chinese doctor from France.
Well, that's what I thought I would do. It was my plan.
Yeah. But it's Can you explain what what is acupuncture? Because there's a ton of studies in the scientific world, in the Western world, that are supporting acupuncture, but I don't know that everyone understands what it is. Can you explain it to a layman person, someone that doesn't know anything about energy work or acupuncture or anything?
Well, there's the basic is where there's stagnation, there's pain. And where there's free flow, there's no pain.
Stagnation of what?
Period. That's how it's translated. So the
Oh.
Chinese kind of think in like these big ideas and then they go bit, so the theory is like stagnation causes discomfort or pain. And so a lot of things can cause stagnation, right? So acupuncture, there's a lot of theories of how it was developed and how some person was like, oh, you can put this and this. But one of the theories is the Yangtze River is a big place where in China where a lot of Chinese civilization, and that was a big thing in Chinese civilization, is how the flow of the water was managed. Mm-hmm. And so the dams, so the understanding is like where they put dams, where they created flow, is kind of they were able to make that analogy of like, hey, if we can move water this way, why can't we create? So what acupuncture is a very crude, is really identifying where there's a point of discomfort, identifying if it's excess stagnation. So you just put the needle in where there's stagnation, and you create free flow. Same way you would with a river, same thing you would with a dam. So if you're, it's very much that. So
that's fascinating.
And not to finish that, but then we can put our Western, our science layer in and make a lot more understanding of it. There's endorphins and there's everything else that comes up, but from a very traditional standpoint, it's that free flow of water, free flow of movement.
So it's really interesting. So I don't know if any of you have ever looked at a book of acupuncture, but the way the acupuncturist meridian are, it's like literally, for me, when I look at it, I'm like, oh, this is where the lymphatic drainage are. But the lymph, the flow of the lymphocyte, which when you just do anatomy, when you just open a body, you cannot actually see. It's really hard to see the lymphatic system when you just do autopsy. So it is actually quite fascinating that they were able to map this out, 2,000 years ago or something like this?
Anywhere from 5,000 to 2,000, depending on.
Okay, wow. And they still continue to use it. So can you tell us a little bit how you practice? How does becoming an acupuncturist looks like? How do you assess a patient, and how do you sort of like look at a patient that comes to you, and what's your next step when you see them?
So I'm going to answer this kind of in my other life. I was actually the Acupuncture Association president of Colorado. I just had to move that. And one big thing that we're looking as acupuncturists is understanding acupuncturists acupuncturists don't have the same education as doctors or chiropractors. Well, we actually do spend 4 years in Chinese medicine school learning exactly that, learning that diagnosis piece, because that's not something that can just, you have to be in clinic, you have to have the theory, and it's so important. So what a patient should, if they go to a licensed acupuncturist, what they should expect a treatment to look like is someone who has been through 4 years of so either an associate's or a bachelor's, and then additional 4 years studying just how to diagnose and communicate. So we're looking, because Chinese, again, we have to look at this medicine that was formed 3,000, a long time ago. And and if you think about it, the biggest things they were dealing with were climate and weather in a lot of ways. Yeah, there was a lot of viruses and bacteria and stuff like that too, but they didn't understand it. So they didn't name it that way. They understood it, but they named it differently. And so Chinese medicine at the core is very much about the climate. So the environment someone's living in, the environment that's in the person's body. And so that's what an acupuncture is assessing, is what is happening in this environment, like the macrocosm and the microcosm. And the 4 easy ways are the 4 examinations. So an acupuncturist is going to look at someone's overall appearance, like the shen, but like how they're carrying themselves. Are they complete? They're going to look at the tongue. So the first diagnosis is observation. but it's a really powerful observation because if you can look at the tongue and then and how the face looks like, there's some acupuncturists who studied purely diagnosis of the face. And so you're going to look at observation, you're going to look at touch. So, they're going to feel your pulses, they may feel your, like I do a lot of cranial work as well in my work. And so I'm going to feel people's feet a lot, but the pulses all through the body. I studied along with a wonderful acupuncturist who did abdominal diagnosis. And so they could tell where those, because if you think of the place where we have the most stagnation with the most blood flow, is often in the abdomen. And then if you can move that stagnation, you're going to free things up and feel better. And so then there's a questioning. I'm going to remember. The fourth one, I think, is like a smelling.
Wow. So quite, I'm assuming a long intake. Is that how you call it?
Yeah, so that's the questioning part. And not necessarily. Like, I've gotten mine down to where I have had some really great teachers who can teach, like, pretty, like, what they called it, like a pretty precise diagnosis. And so I can get mine down in 5 to 10 minutes. I can pretty much. So just because the nice thing with acupuncture is, like, you can put a needle in and that can change someone's life. But you can also put a needle in and, like, oops. I mean, it's consequential in every, the intention is so important and the relationship is so important. Yeah. But unless you do something really, really wrong, and hopefully we'll get some ideas of, like, don't go to an acupuncturist if they do this, or a PT if they do this. Yeah.
So going back to that sham versus real acupuncture needles, what's fascinating to me as a scientist is that, there is definitely a difference. You wanted to mention something about this. Do you want to tell us?
Well, I think for the person, like, who's trying to understand this, that again, in so much of acupuncture has different lineages and different schools, and so there's definitely effect. I mean, you can think of that's beyond placebo from the studies that's showing us that we don't necessarily do different anatomical positions, but there's also something about what your intention is and what you're trying to do. And so and that's where this energy part of Western medicine comes in, because we're like skeptical, is like, oh, but how can intention and it's not. I had one of my teachers talk about intention versus attention, and so the attention, and so Japan came up with a very important, like, lineage of Japanese acupuncture, and then Korea has a very important Korean acupuncture, and China has multiple different, and so when we talk about acupuncture, we have to respect the cultures as well it comes from, and also then with dry needling, I was saying how it very much comes from a very strong Western PT culture that it's interesting how these different, there might be some root in it as it's a physical body, but they had all these different groups of people looking at it, and there's actually a fairly good consensus of, like, no, this isn't belief, this is actual, like, physical, you're making a physical. So that's where that attention is, because each school is going to look at it slightly different. But if you relate to that, like, if you relate to the practitioner, or, if you're trying to, like, if you understand what the practitioner specializes in and it matches what you're doing, that's only going to resonate that already, that doctor-client, patient, and that resonate that sham from where it's like, oh, this beats sham, to, wow, this is healing. Right. And so much of that's who you're getting treated, what their specialty is, but also where they studied and how they studied. And it's worth asking about that. Yeah.
So you mentioned something about the sham, not the sham, sorry, the dry needling. So you started mentioning something about, like, the healing. Can you just, like, what's the difference between acupuncture and dry needling?
So I think there's a lot of PTs in the United States, and so it's really great. Like, a lot of people get PT. And so if you look at the history of dry needling in the United States, in about the 1950s, there was a bunch of PTs working together who started understanding anatomy trains. And again, we don't know if it totally came from China, like the understanding that these connections were made, or if they were just, like, logically looking at the body and seeing, oh, you move this muscle, you're going to get this biodynamic or biotensionality idea of tendons being connected. And so what they did is then, which is slightly different than acupuncture, but the technique is the same and the training is the same. The training's not the same, but they came in with they identify points of tension, and the Chinese would call it shi or stagnation. Back to what is acupuncture? It's where there's blockages, somewhere lymph is stuck or muscle is stuck. Or I think one thing we're finding is a lot of trigger points are often where these like baby nerves come together and the muscles get dehydrated or something, and they pinch it, and then you have a pain somewhere else. But if you're able to put something in that point and cause that muscle to contract, kind of the body then unwinds. And so that's what PTs are kind of, I would say that traditionally dry needling is non-retention, meaning you find that point of tension or that point where there's contraction, you put the needle in, you stimulate it, and release it, and then you pull the needle out. And I would make, and again, I'm sure doctors and acupuncturists could debate this for a long time, but I would put this out there that that's kind of, in a way, you're also getting that movement of the muscle, but in a way, you're actually getting a pro-inflammatory response. Like you're causing the body to really heal itself by causing an injury, right? So you're like, oh, injury, body has to come, and that's what inflates. So it's pro-inflammatory. I would say acupuncture does that, and it's within acupuncture. PTs in Colorado only need 25 hours of needling training to be able to put a needle in someone. Acupuncturists do about 700 to about 1,200 hours of actually how to put needles in.
Yeah, it's probably different. It's a nice add-on to their toolbox.
Yeah, and they understand anatomy. Yeah. And I would say PTs understand anatomy at such a profound level, but sure. No. I mean, there's not a huge amount of demonstrated injury. There's some for sure.
Yeah. I'd love to ask you some of your experience with yourself and with patients. Like, can you tell us like what you have experienced as an acupuncturist? Like, because you're clearly passionate about it. I have at least 3 or 4 people who've told me how amazing you are. Can you just just tell us about your experience as an acupuncturist?
There's some. I mean, I think that again, my teacher is he had this. He passed away a couple years ago, and at a very young age. And so in the community, he's very well known, and he's very this intention out. And he's the one who was like, it's not about intention, it's about attention. And I think sometimes that's really the key. Is I think the magic and the hope is having someone pay attention, and not even just pay attention to what you're saying or what you're experiencing, which most acupuncturists do a long intake and have that great conversation, and especially certain schools. But it's also that intention of and listening of what's actually happening in your body. So like what I love about acupuncture is understanding the harmony or the movement or the vibration of the different organs, of the different meridians, and how they each tissue actually has its own harmonic effect and kind of beats at its own pace. And to actually pay attention to that and have someone help you, like that's such an experience. And that's, as an acupuncturist, I would say, that's my favorite part. I especially love when I want to say that. It's like I loved when I was doing it a lot of times. It's always my favorite was helping start labor, and not really start labor, but like supporting pre-birth and pregnancy. And you could just feel like right before that, like the baby was going to come, you could just feel that energy just like harmonize into like, and then that opens up like that flower. And that's why I would love coaching. So I think and to understand we do that, our nervous system, our body, our flow is so dynamic that we're not just the solid.
I need to ask you. Sorry, I'm stopping you there because I need to ask you. How do you feel that?
Lots and lots of attention and practice. I mean, and we all can do it.
And then so let's take the mom that's about to deliver. Like, how do you, or that you want to stimulate? Like, what do you do with them? And I'm sure it's different depending on people, but
I would say it's not that different because it's grounding, it's connecting, it's being in yourself. And I think that's what's really nice about acupuncture at the root of the school is that it's very much about understanding the boundaries of yourself and not trying to necessarily influence someone, but meeting that where they are. And so acupuncture, you're putting a needle in, but it's not like a chiropractor. I mean, I love chiropractic massage, but you're actually influencing, like really directly influencing tissue. With acupuncture, kind of doing a diagnosis, unless you're doing really strong sports therapy where you're putting big needles in. You're kind of just putting a needle in and letting the body do itself. And so when I'm finding the harmony and found it's literally just listening. So and it took years because I'm an analyst by heart. I don't like the scariest thing for me is to be around, just to touch people and to be. So it took years and years of just practice and paying attention and, you know, having people who trusted me enough to let me
And
just listen.
how does that look to pay attention?
I think that's probably where it's a little different for everyone, but it looks like boundaries. It looks like two people willing to come into a space and be just present. And so what I try to cultivate in my treatment rooms is that presence, but also that non-judgment. And then where I'm kind of like diagnosing, but once we actually get on the treatment, I kind of have an idea. But that harmony, I mean, this is not every acupuncturist works this way, but that harmony and that flow kind of directs where that movement want to go.
You're putting your hands here. Are you putting your hands on the patient?
Often on my feet.
The feet?
The feet is a big
And you can feel?
Yeah, and again, if you put, like, if I'm trying to, and the liver, so like if I'm trying to treat liver, I'll go and actually put my hands on someone's liver.
And you can feel, I'm sure, like, and especially Western medicine, where I did a little bit of training in India, and they're so good in diagnosing. And I think we're losing a little bit of that because we have such amazing diagnostic tool now, like, you know, an MRI, ultrasound. But can you feel, you can feel the liver? Like, what's the
so my teacher, speaking of, so Chip actually studied with a DO, a doctor of osteopathy. So his training came through a DO too, and he's Japanese. So yeah, you're actually feeling like the rhythm, and you're feeling where those points of tension are, and literally, if you're attending and not trying to influence, like, and that's really this big difference of like, oh, I'm going to respect the patient's boundaries. I'm going to I'm not trying to necessarily like, oh, this is what has to happen. It's the boundary with the willingness to like listen to what is and allow it to unwind. So the idea is if there's tension and you put a needle in, you're going to change the whole dynamic of that body. But then ideally you want to get that liver, if it was kind of feeling like this, you want it to feel like this. And that will happen over the course of a treatment. And so that's kind of the idea with every needle. Like I was saying, like a sentence. I always think of an acupuncture treatment as sort of like a sentence. And sometimes, you know, three words is like the most powerful thing. And sometimes you need like 15 or 20 words.
Yeah.
And I think that's sometimes you try to do too much, and then that harmony gets off. And then what I was saying is talks about like needle shock, because that's really the big harm that come from acupuncture is too much treatment. You get inflamed to a really high level, and for some people who have, you know, really sensitive systems or really vigilant systems, I like that word better. That, you know, 2 needles, you know, 5-10 minutes. They got that rhythm to where they can take and they're done. And so that's part of the art, but that's why it's like always starting with the boundaries and listening to what the patient says, because if you can't like just be there and present, you can't attend to it.
Yeah. So can you give us a story of hope? Because it's UnabridgedMD, so hope driven by science.
I have so many after doing this for 15 years. I think one of them, again, going to pregnancy, since that's what we kind of went with, was I remember it was about 5 years ago. I was the Friday night. I was worked out, 40 patients, and my friend who specializes in fertility work called me up. She's like, I have a patient who's 24 months pregnant. She's just 24 weeks pregnant, and she just went and started contractions. Can you go to the hospital? The hospital will let you in, which one is kind of amazing because that often doesn't happen. But the Presbyterian was great and let me in, and they just begged. And so I put in 2 needles, and she was all hooked up, and you literally could just put in 2 needles, and you literally could see the contractions. Like 2 needles.
I should have gotten you. I got them at 25 weeks. Maybe I had that instead of the magnesium.
Well, they did the magnesium too, but the magnesium, I mean, she lived, the pickle juice worked. I mean, she did all of that.
Wow.
But yeah, you could literally see on the
wow, that is powerful.
Yeah, so within, I think I came, so she got over because they were sure she was going to miscarry. I mean, they were positive. And so she got over the hump. And then I came like every 2 or 3 days for about 10 days. And she actually ended up going home, which, I mean.
That is powerful. That's powerful.
My other favorite pregnancy story is, again, if you do fertility work, I had a patient who she'd gone through all of the things, and her uterine lining, I think, was 2 millimeters by the end. But this was the last time she was going to do it. She's like, so she had no hope. And I'm like, let's just, even if they say that this is a miracle, like, let's just try it. And we ended up doing a bunch of acupuncture. You know, C-serum supported her super, super well. She ended up getting pregnant, carrying it to term. But the kicker is, and then 18 months later, she ended up getting pregnant naturally.
Wow.
And so
That's really good.
So there's a lot of cool
It is very cool, yeah.